In today's important talk, we will discuss the role of HBOT in treating phantom limb pain. I became interested in studying how HBOT would help phantom limb pain after meeting Becky recently. She's having pain in her leg after having an amputation in the lower leg due to cancer. Her husband asked me if HBOT could help. I told him that I would do some research. So what did I learn? I learned that HBOT can help phantom limb pain along with many other types of pain. And I'm looking forward to sharing that information in this talk with you today. And I learned that I now can't wait to help someone with this condition. So what is phantom limb pain? Phantom limb pain is a real and sometimes debilitating sensation of pain that originates from a body part that's no longer there. Though not fully understood, the condition is believed to be caused by complex changes in the brain, spinal cord, and peripheral nerves following an amputation. What are some of the common symptoms of phantom limb pain? Phantom limb pain varies from person to person in intensity and type. It's often described with the following sensations: aching, burning, cramping or squeezing, itching or tingling, sharp shooting or stabbing pain, throbbing, feeling as if the missing limb is twisting or in an odd position. What are the causes and contributing factors of phantom limb pain? While the exact cause is not known, several neurologic factors are believed to play a role. So, for example, brain reorganization. After a limb is amputated, the brain's sensory map tries to reorganize itself. Areas of the brain previously dedicated to the missing limb may be invaded by nearby regions. This can cause the brain to misinterpret signals, leading to pain. Another cause of this condition is nerve damage. So the severed nerve endings at the site of amputation can become irritated or form neuromas, which are tangled masses of nerve tissue. This can cause them to send abnormal or spontaneous signals, which it interprets as pain. Another cause is central sensitization. So this is where damage to the peripheral nerves can make neurons in the spinal cord more sensitive and active, which amplifies pain signals sent to the brain. Another cause of this condition is psychological factors. Stress, anxiety, and depression can increase a person's perception of pain and may trigger or worsen symptoms. This isn't to say this is solely a psychological issue. Another cause is pre-amputation pain. Individuals who experience significant pain in the limb before it was removed are more likely to develop phantom limb pain afterward. Another hypothesized cause of phantom limb pain is a spinal subluxation. That's a bone that's out of place, putting pressure on a nerve. While chiropractic care focuses on the back and is often used to address chronic back pain, it is said to positively impact phantom limb pain. So if you lost a lower limb, you might already be at risk of experiencing back pain. Additionally, pain from the sciatic nerve, which runs from your lower back and down through your buttocks and leg, can play a role in phantom limb pain. So this nerve can cause referred pain. You feel the ache in your amputated limb or in the part of the appendage that is no longer there, but the pain is actually caused by the sciatic nerve. Chiropractic care can address that issue, reducing the discomfort in the back, and according to an article by PAM Health, phantom sensations. So what is the outlook for phantom limb pain? For many people, phantom limb pain decreases in intensity and frequency in the months following an amputation. For others, it can become a chronic condition that persists for years. What is the frequency of phantom limb pain? A 2024 meta-analysis found the pooled prevalence of phantom limb pain to be about 57%. A meta-analysis is an examination of data from a number of independent studies of the same subject in order to determine overall trends. Further, a 2023 review reports that 60% to 85% of amputees experienced phantom limb pain. So now let's talk about some of the studies that I found as I was looking to see how hyperbaric oxygen therapy can help phantom limb pain. So first of all, a study published in the journal Emergency Medicine called Disappearance of Phantom Limb Pain Following Hyperbaric Oxygen Therapy by Banham and Keatley. This was published in June of 1991. In the abstract it says the following: a 67-year-old man with severe peripheral vascular disease and subsequent bilateral below-the-knee amputations was treated with hyperbaric oxygen therapy for non-healing ulcers on his right leg stump. After one treatment, which was 105 minutes, His previously severe phantom limb pain resolved and has since not returned. Isn't that amazing? Our second study was found in the Journal of Pain Research. This is published July 31st of 2019. And so a single session of hyperbaric oxygen therapy demonstrates acute and long-lasting neuroplasticity effects in humans, a replicated randomized controlled clinical trial. This is done by Anna Wall and her colleagues. So this study demonstrated that a single HBOT session compared to control is associated with both acute and long-lasting mitigating effects on burn injury-induced secondary hyperalgesia areas, confirming central anti-inflammatory neuroplasticity effects of hyperbaric oxygen therapy. So for these people, they used a device to burn them, and so they looked at how they responded to these burns. Some of the supporting documents we found was as follows. In a journal called Research, hyperbaric oxygen therapy was effective in the treatment of chronic pain, according to Dr. Jose Fabriget, director of the chair of hyperbaric oxygen therapy at the Catholic University of Murcia, has lectured on the latest developments. UCAM holds a scientific seminar on the benefits of this technique in amputated patients. So this is somebody that's studying in Spain. One of the ideas highlighted by the experts who participated in the scientific seminar on the integral recovery of amputated patient was organized by the UCAM chair of hyperbaric oxygen therapy. Was what the world surrounding the person who has suffered an amputation is very complex, but many points of view. Dr. Jose Fabriget, director of the chair, lectured on the latest developments in the medical use of hyperbaric oxygen therapy. He said, quote, "It has some recognized indications which, as a result of clinical experience and research, are growing," unquote. With regards to its application to people who have suffered an amputation, he pointed out that one of the fields in which great efficacy has been shown is the treatment of chronic pain, and significantly of neuropathic pain acting in a beneficial way on the peripheral nerve. So he said, quote, "Medical practice has allowed us to see how amputees with phantom limb pain, badly controlled with traditional means, greatly improved with treatment in hyperbaric chamber," unquote, he said. So that's pretty cool to see that. So let's now talk about the role of HBOT in pain treatment. So this is from an article I found online, written September of 2020. Hyperoxia triggered by hyperbaric oxygen treatment generates a series of psychological effects that produce multiple benefits. Among them, its analgesic and anti-inflammatory effect and the consequent relief in all pathologies that cause pain. In inflammatory processes that produce pain, hyperbaric oxygen decreases the production of inflammatory interleukins such as interleukin 1, interleukin 6, tumor necrosis factor alpha, and increases the production of anti-inflammatory interleukins such as interleukin 10. It generates non-hypoxic vasoconstriction and reduces edema. Fluid extravasation, this is where fluid leaks from a blood vessel into the surrounding tissues, contributes to its action in the processes where inflammation causes pain. That's why it can be useful in post-surgical recovery, severe trauma, burns, and complex wounds. Hyperbaric oxygen also promotes peripheral axonal regeneration, induces autophagy, that means cell death, of damaged mitochondria, improves nerve transmission potential, mitochondrial functionality, and restores synaptic transmission. It reduces neuropathic pain and pathologies such as spinal cord injuries, trigeminal neuralgia, phantom limb pain, neuropathic wounds, and they list some other types of pain at this point. So let me summarize what I just said here. HBOT reduces neuropathic pain and pathologies such as phantom limb pain, as well as many other types of pain. In summary, after spending a couple hours looking for the answer to the question of can HBOT help phantom limb pain, I can definitely say that would be worth your time to give it a shot. We recommend a frequency of at least 3 times a week. While I do not know the minimum pressure needed to address this issue, I would offer to start with whatever equipment that you have available and see how you progress. It is said that what you don't have in pressure, you can often make up in time. With that said, further studies of phantom limb pain may show that the best results are attained in the pressure ranges of 1.5 to 2 atmospheres, which is often where neurologic issues are best treated. In the US, all pressures beyond 1.3 atmospheres are to be done in a hard-sided chamber. If you have any questions, please feel free to leave those in the comments section below. Also, if you have any suggestions for future topics, you can leave those in the comments section below. To learn more about our clinic, see our website in our description below. As always, it's been a great pleasure to talk to you. I look forward to talking to you on our next video.